Chances are you're here because you have CRPS, or what was formerly known as RSD. And what I want to show you is the way you've been treated. Okay, if you haven't gotten improvement, there's a reason you haven't gotten improvement. They are staying on the injured area, the painful side. All right? And what I want to show you is what happens if the rest of the body, which moves well, is included in your treatment. For example, let's say I have CRPS here in my right arm. Has anybody gone to your left and moved it to see if it gets better? Has anybody gone to the trunk and done some motions to see if it gets better? Has anybody gone to the left leg or the right leg to see if it changes this? And chances are no. And I want to show you the power of treating into motions that move well in other parts of your body can do for your CRPS. Cool? All right, so let's get started and show you what that's all about. Before I do, my name's Tom Dalonzo-Baker. I'm a physical therapist from Raleigh, North Carolina. I'm the guy who had the aha moment in this process in 2001. I've done it on my patients since then, and then I started teaching it to therapists around the world in 2005. Over 15,000 clinicians have learned how to do this process. It's the same process whether you're a patient or a clinician. You can become your own little mini therapist, all right? So let's take a look at what this looks like and get you to treat yourself so you can get help. So there are 3 body areas that must be treated. I am going to show you the basic level. Many of you are going to get 50% or more improvement, all right? Just from the basic level. I was a math teacher before I was a PT, and I say what I'm going to show you is how to do single-digit addition, not double and triple. I'm not going to show you add or subtract and multiply and divide. That's more complex stuff. All right, which you'll need eventually. But right now, let's just get you some help. Let's make you see that, oh my gosh, treating the other areas of the body work, and let's get to it. So, arms. What we're going to do is we're going to find a motion that's yucky or bad or painful in the arms, and one that's good. We're going to go to the trunk and find a motion that's restricted or painful or harder on one side than the other, and then we're going to go to the legs and do it. It doesn't mean it's part of your presentation. Like if I have right arm pain, it doesn't mean that I'm looking to see if the trunk twist is increasing this. It may, all right, but when I'm doing the trunk and looking in the trunk, I'm looking to see which one moves easier, which one doesn't move well at all, okay? I'll show you how right now. So everybody, let's do what we call the one-step quick fix. Let's just go, oh yeah, I'm going to go up here and I go, oh yeah, that bugs me. I can't do it very well. Awesome. I do this one, feels pretty good. All right, feels normal-ish. Good, that's one we definitely want. We want to score this though. So if I say to my patients, is that a low, medium, or high amount of yucky, hard, difficult to move? And they say yes, and I go, good. Is it a low, medium, or high? And they say it's a medium. Well, let me give you what the scores relate to. A 10, 20, 30 is a low. A 40, 50, 60 is a medium. And a 60, 70, 80, or sorry, a 70, 80, 90, or 100 is a high. So I say to my patients, low, medium, or high. And let's say they only get up to here. Let me go, that's not very good. That's a high. Good. 70, 80, 90, or 100. That's an 80. Okay, cool. So they feel what it feels like and everything else. And I say, all right, what we're going to do is a one-step quick fix. Yet, all we have to do with that is we're going to come over here and treat this side. All right, we're going to treat it, and what I mean by that, which is going to lift up for 2 sets of 20. Okay, just up, 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 back, get into end range. Don't just, oh, I'm like this, that's it, that's all there is, all right? Work into it, up to the ceiling, pull back, good. And you don't have to come all the way down, you come here, up, boom. Now, if both sides are hurt, right, if both sides are bad, this isn't the exercise you're going to do. You'll wait for the other body areas. Okay, so do 20. Rest, how long? 15 to 30 seconds, I usually say. Or, I don't know how conditioned or deconditioned you are. So do it, or start the second series of reps when you're ready. You know, most people don't need more than a minute, usually 15 to 30 seconds. But now I'm going to do the the reps of 20, the second reps of 20. Good? Again, I'm not going to hit 20 just for the sake of the video. All right, let's say I've now done 20. When I've done that, I'm now going to recheck this, and let's say it goes to here. So now, I say, how much better are you? You were at an 80, and I might say, oh, that's a 60. Now, for CRPS, what happens sometimes is this. Your motion improves but your pain still stays the same today. But then tomorrow, or maybe even 8 hours later, all of a sudden, not only is your motion better, but your pain is too. That's what we've noticed with our patients that have CRPS. Okay, so really make sure the motion gets better, and if it does, your pain should go away. If not today and now, then tomorrow and all. Okay. Okay, so it improved. It went from 80 to 60. As long as it's improving, you're going to keep doing it. So now I'm going to do another 2 sets of 20. Okay. Now remember, lift up to the ceiling, get your rib cage into it, and pull back to this. Boom. Nothing more than that. I'm going to do 2 sets. I'm going to do my first set, rest. How long? I typically say 15 to 30 seconds, or basically, when are you ready to? Need a little longer? That's fine. Need a little shorter? That's fine. 2 sets, or another set of 20. After you get that done, recheck this, and you go, whoa, wow, that's significantly better. 80 to 60 to 30. Awesome. You're improving. So it means keep doing it. If something's working, keep doing it. So you do it again. Okay? 2 sets of 20. Get your 2 sets of 20 in. When you're done with your 2 sets, you recheck, and let's just say it stayed at 30. So we went from an 80, I forget what I said, to a 60 to a 30. But it now has plateaued. Awesome. You're done with the arms right this second. Now we want to go in the trunk and find something in the trunk that moves hard and one that moves well. So this one is harder, this one's easier. And this one feels normalish, this one's just tight. It doesn't mean it's bringing on, or it doesn't mean it's bringing on my pain right here. Fair? Okay? Sorry about the truck in the background. So this trunk motion, this is normalish, it feels good. This is a little tight. Low, medium, or high? For me, low, let's just say. What number? Let's say I call it a 30. Okay? It doesn't mean that it's doing anything to my arm. Okay? So that's my bad. This is my good. I'm going to do 2 sets of 20 over here. Right? Really getting the end range. Notice I'm not moving my arms. Okay, I'm moving my trunk. And really get into it. If your head, my head doesn't usually like to turn all the way with it. I like to be like right here with my head. Let your head be comfortable and turn and twist your trunk. Okay? Do 2 sets of 20. Again, after you get done with the first set, rest 15, 30, 45 seconds, a minute, whatever you need to. Then do the next set. When you get done with that, you're going to recheck this side. You can say, wow, that's a lot better. Okay, hopefully. So let's say it was a 30 and you say it's a 10 now. Now you're going to recheck this. If it was a 30, and goes higher. That 30 went now to a 20. The trunk is now changing your bad arm. Okay, it helped this, it helped this. Let's do it. You do another 2 sets of 20. Okay? When you do those 2 sets, you recheck this. All right, that feels like a 0. And you recheck this. And let's say the 20 stayed at 20. Okay, now my trunk is plateaued. Awesome. Okay, no biggie. Let's now go to a leg motion. And I'm going to come out here. I like to turn it in the side to show you guys. But the big thing is don't lean against the back of the chair. I want to show you that kick your leg out. Test it. As long as this thigh gets closer to your chest, you're doing great. Don't sit up straight and try to do it. Let yourself slouch. Let yourself go into a banana shape, if you will. Test this one to the other leg. This one's a little harder for me. I'm going to exaggerate it here. I say, is that a low, medium, or high? It's a medium. Okay, I'm going to give it a 50. Awesome. So I got a 50 here. This was a 30, but it went to 0. And then I've got something left here. What did I say? I was 20. Okay, good. Again, you should write this all down on paper. But I'm going to go and do 2 sets of, the leg is heavier, right? So for those of you maybe 12 or 15 of these, I'm going to do 12 or 15. All right. When I get done, I'm going to rest as much as I need to, which with this, because it's a heavier thing, you may have to rest a little longer. When you're ready, you're going to do the next set. Okay. When you get done with those 12 to 15, some of you can only do 8 to 10 maybe. You're going to recheck that right leg that we said, I think we said it was a 50. Lift it up. Go, whoa, that's a lot better. It went down to like 20. Awesome. Make sure your trunk still feels good to the bad side. And then raise this. And you'll go, wow, that feels a lot better. So now that, what did we say? It was a 90 to begin with, went all the way down to, or an 80 to begin with, went all the way down to, it was a 20, it was kind of plateaued. And now I say that's a 10. Maybe I even say it's a 5. If I say it's a 5, anything that's 5 or less, we're done for the day. Okay, now if you plateau in all of these, you're done also. We oftentimes just do 2 body areas, maybe arms and trunk, maybe trunk and legs the next session, maybe legs and arms the next session, because we don't want to spend a lot of time. We usually spend about 10 minutes maybe. All right, so let's just say it got me down to 10. I'm almost there. I did another 2 sets of 20. When I'm done with my 2 sets, I recheck this. All right, let's say, I forgot to say it to you. When I rechecked this, yes, I did. I said it went really good, felt good. Let's say it went to a 20, now it's a 0. This feels good. I lift this up and I go, wow, that's awesome. You guys with CRPS may go, I've got the pain, but that motion is the best I've lifted in 3 years, 3 months, whatever it is. When I've done this on people with CRPS, it's really amazing what happens. Okay? However, I will tell you this. Sometimes these motions on the arms, the trunk and legs aren't the ones you need. I find people with CRPS needing to go oftentimes in forward flexion like this. Like maybe they don't like this side and they love this side. And they'll really say it. Or they'll lift a bent leg up and they go, ooh, I like that. And I don't like that. So a lot of times it's flexion stuff. Things are coming forward because there's some sort of tightness going on in here oftentimes. And you guys often go from pain to maybe gastroparesis, and maybe the formation of that is what's actually tightening and pulling here and beginning the problem and causing it, maybe, okay? All I know is that when a lot of my patients go and do this and this, they'll say, oh, I like that side better. And they'll do it, and it has the biggest release. So in my trunk thing, instead of doing the twist, tomorrow you may say, I'm going to test out going into flexion. Maybe the next day you're going to test going right-sided extension and left-sided extension. Those are more advanced things. If you look down below, there's links. One's for general public, it says outsmartpain.com. One is for clinicians called totalmotionrelease.com. Go to them, shows you many more videos, not necessarily on CRPS, okay, but on how this process of using good motions help painful motions in painful areas, in painful things, okay? They don't have to be pain, it could be restricted. It could be athletic injuries. It could be after surgeries. It could be before surgeries, all right? So go to those pages, check out more information. You'll get a feel of it because this is awkward at first. Number one, you're going to do it and you're going to think, or you're going to watch this video and you may say, I'm not doing that. It just looks weird. That just has to only, that must only help for a couple minutes or something, or maybe it won't last. Well, you got to experience it. And then if it comes back, treat yourself out again. And then maybe instead of it lasting an hour, it lasts 3 hours, or maybe it lasts 5 hours this time. And the homework is simply this: test your motion. If all of a sudden you go, ooh, I'm still good, and you test yourself 2 hours from treating yourself and you go, still good. 2 hours later, check yourself again. Oop, I'm a little restricted. Okay, go treat 2 of the 3 body areas, arms, trunk, and legs. It's pretty simple. However, the longer you've had your CRPS, the more in-depth knowledge you need to have to find deeper and deeper restrictions. As I said in the beginning, I'm going to give you, I'm a math teacher, remember, prior to being a PT, and I just gave you a very powerful process you can use to fix yourself. But it's just single-digit addition. There's double-digit, triple-digit, there's subtraction, multiplying, dividing, algebra, geometry, trigonometry, calculus, meaning there's harder and harder and more complex problems that have to be solved. If you've had this for 3 weeks, many of you haven't, it's chronic. If you had it for 3 weeks, maybe a month, this may help and that's all you need. Chances are you need to dive deeper into this stuff. In those, even on the pages, outsmartpain.com for general public, totalmotionrelease.com for clinicians, there is our packages on there ranging very low to moderate pricing, so that every single person can dive deeper in and learn this more and more and more and get more and more benefit. So I'm hoping that so many of you have, for the first time, some major hope in, wow, this can help change me. All right, then, if it changed you, then go and look at the rest of this stuff and say, okay, I'll take the next step and purchase this one. Purchase what financially you are able to. Cool? I try to have variable prices for everybody, and I explain it very well on the website. Okay, gang. If you have questions, make a comment down below. If you have great success, right, and it was really cool and things changed, make a comment down below. All right? Again, that's when I may say that, usually people are watching this on YouTube. If you're watching on another page, there's probably a couple buttons you can click for the web pages, and you not necessarily can make comments and all. Also on the web pages down below, my personal cell phone is on there for you to contact me if you need to and ask me questions. Fair enough? All right, go get your good sides and fix that pain that's going on. And remember, your emphasis is finding motions that move well. Those are going to be the things that change you, because if the things that were going to change you, treating the injured side, were going to work, they would have worked. Because they didn't. They may have worked for a little bit, maybe got you better than you were, but then you plateaued with it. So it's time to move to other areas. Cool? Thanks for joining me. Take care now.